Okay, I just want to start by welcoming everybody. My name is Andrea Roberts, and I am part of the survivorship care team here at Advent Health North Region. Thank you for joining us and being part of the first presentation of the Cancer Education Series for 2022. Today's topic is living well after cancer. Just a little housekeeping before we get started. Please keep yourself on mute. You can use the chat box or raise your hand if you have questions, and there will be time at the end of the presentation for any additional questions and discussions. I'd like to ask you to bow your heads for a prayer. Thank you, God, for allowing us to join today. We pray that you open our hearts and minds to your wisdom. Remind us to always give thanks for your love and comfort that always endure. Amen.
Thank you, Andrea. So I will introduce Holly. She is our speaker today. Holly Susie is a registered nurse. She's an oncology nurse navigator at Advent Health DeLand Cancer Center. Holly grew up in New Jersey, and she graduated from Southern College of Seventh-day Adventists with an associate degree in nursing. Holly has been an RN for more than 36 years and has worked in OB/GYN, med-surg, physicians' offices, public health, and oncology. Holly has worked as a nurse navigator since 2009 and has been an oncology nurse navigator at Advent Health Fish and Advent Health Waterman prior to coming to DeLand. So we welcome Holly in her talk.
Welcome. I'm Holly Susie, the Oncology Nurse Navigator at Advent Health DeLand Cancer Center. I'm so glad that you're here today. We're going to discuss living well after cancer, living your best life. The subject is survivorship. And survivorship is the period of time after you finish cancer treatment. And a lot of people have a different opinion on what a cancer survivor is, but this is my opinion and my belief. Who is a cancer survivor? A survivor is anyone living with a history of cancer from the moment of diagnosis through the remainder of life. If you've just been diagnosed with cancer, you're a survivor. If you've been in remission for 20 years, you're a survivor. If you're an adult who had cancer as a child, you're a survivor. If you're living with cancer as a chronic disease, you're a survivor. If you're currently in active treatment for cancer, you're a survivor. If you've beaten cancer and been declared cancer-free, you're a survivor. Whether you're in treatment, just diagnosed, or been in remission for 20 years, you're a cancer survivor. So you rang the bell. Your treatment is over. What now? You have been focusing on getting through your treatment day by day. It's been your full-time job. Now you're going to enter a new part of your life, what I like to call 2.0. So what is the next step in your life? Well, I like to talk to people about survivorship. It used to be that you would ring the bell or finish your treatment and you were sent out the door with very little instructions or support. But things have changed during the years. The Commission on Cancer has encouraged cancer centers to start having survivorship programs, survivorship support groups, and for staff to do what they call survivorship care plans. What is a survivorship care plan? Well, a survivorship care plan is a treatment summary that is usually given to a patient by an oncology nurse navigator or a nurse. It is the next step. It helps transition patients from being in treatment to being in survivorship. It is something that you should keep with your health records and share with your physicians. It outlines your cancer care and what you need for surveillance and for recommended testing. It also lists possible late and long-term side effects. When you're first diagnosed, and they tell you what kind of treatment you're going to need, they list all these side effects, short-term, long-term, and to be honest, I think that most patients are just interested in the short-term and getting through them. So this is something to remind you what to look out for. Also, a big part of the survivorship care plan is the recommendations for lifestyle changes. This is the point of your life after cancer treatment that you can make changes that will help prevent a recurrence and help you live a better, healthier life. For example, smoking cessation, increase in exercise, weight management, whether it be an increase in weight or weight loss. And there's many things that the patient can say that they would like help with. And that is something that we focus with on the survivorship care plan. Possible long-term side effects of cancer treatment. There are many different side effects according to what kind of treatment you received. But these are some main things that I wanted to discuss today. One of the major problems would be from surgery and lymphedema. A lot of people have heard of lymphedema being associated with breast cancer surgery. It's when you see someone who has a backup of fluid in their arm or hand, they may be wearing a compression sleeve. It doesn't only happen in the arm, it can happen in the legs from abdominal surgery, and it's not something that can't be helped. There are lymphedema therapists, and both occupational and physical therapists, and there's lymphedema programs. And actually, we have wonderful lymphedema programs here at Advent Health in the region. And that's something that if you need more information about, you can contact me. One of the other things is loss of a limb or partial limb. And rehab or physical therapy can help with all different sorts of gait training and help with regaining strength. And that's something to talk to your doctor about. And something that the younger patients deal with is infertility or the fear of infertility. And there are, I will speak about it a little bit later, but there are some programs that they can talk to and research about help for infertility. One of the other long-term side effects is cognitive problems due to chemo or high-dose radiation to the head. Everyone's heard of chemo brain, and some people say it's a fallacy or old wives' tale. But I happen to be an old wife, so I believe in it, and it is a true thing. Chemo brain happens to people who have chemotherapy, and sometimes they have a hard time remembering things or word retrieval. And there are different things that you can do to basically brain train. A lot of people like to do crosswords or apps that they call brain training. Something that a lot of people don't know about are dental and oral health problems. Steroids, chemo, or radiation to the head and neck can cause these problems. It's very important for a patient who is having any kind of head and neck a treatment to have dental exam or any needed dental procedures done prior to having treatment for head and neck cancer. And then again, after their treatment, they need to be examined. One of the big side effects is fatigue. People may feel fatigued 6 months down the line after finishing treatment. And there is rehab and physical therapy for that. And sometimes it just takes a while, but there are definitely programs to help patients regain their strength. Peripheral neuropathy from chemotherapy is when patients have numbness or loss of sensation in their hands, their feet. They may have tingling, and as they describe it, it's almost like a painful numbness or tingling. And this can be helped with some medications and also strengthening with physical therapy. There are also some people who believe that when receiving certain types of chemotherapy, if you apply ice packs to your hands and feet, it could help reduce the chance of peripheral neuropathy. And the last thing I want to discuss is secondary cancers. There are some cancer treatments, some radiation therapy and some chemotherapy that make you at higher risk to getting secondary cancers. That is why it's so important to keep up with all your screening, your colonoscopies, your mammograms, blood work. This needs to be something that you do at a regular basis as your doctor tells you after cancer treatment. So what kind of resources are there out there for patients during survivorship? There are a lot of resources, but as I always tell people, be careful.
I'm just going to pull up the interview one moment.
Hi, I'm Holly Susie. I'm the oncology nurse navigator at Advent Health DeLand Cancer Center. I'm here today to speak with Ellen Solomon. She's a cancer survivor, and she was treated at Advent Health Cancer Center in Orlando, back when it was Florida Hospital. Ellen is here today to talk about her experience with cancer treatment and her survivorship experience. Welcome, Ellen.
Thank you very much. I'm happy to be here.
I'd like to start back with when you were diagnosed and what kind of cancer you were diagnosed with.
I was diagnosed in June of 2013, and I found out that I had a mixed Mullerian type of cancer in my uterus. So I had surgery done, a complete hysterectomy, and afterwards I did start chemotherapy.
And how long did you receive chemotherapy? Do you remember?
It was 10 months. I had two different types. One lasted 4 months, and then the other one lasted 4 months. But in between, there were a couple of months that were taken off. But it was a 10-month total.
And what kind of side effects did you have from your chemotherapy?
Oh, I was very well treated in that I received 5 different medications prior to starting chemo that were to deal with my nausea. And so I was prepared for anything that I needed. So it was a different degree of intervention, so I could go from level 1 to level 5. In addition, so I didn't really have a lot of nausea because before each treatment, the doctor had prescribed some steroids and some other interventions that would help with that. But I found that my arthritis and my joints would swell up, and that I had a great deal of pain after the treatments, within like the week after the treatment. And so it would be very painful and slowly subside, and then I'd get another treatment. And that was the biggest effect during the treatment. Of course, I lost my appetite. I lost my sense of taste. Everything was, so, you're very fatigued. There were a lot of different, different things that you go through with it.
Did you lose your hair?
Oh, yes. I lost all my hair everywhere on my body. Yes. So, yeah, then you are colder than you've ever been before because you have no hair. And, you just feel weak and kind of listless, along with the aches and the pains.
So when you were done receiving the treatment, the 10 months, what was your first thought of about your survivorship? What was the most important thing for you to regain after you were treated?
It was the fact that I wasn't going through that cycle of painfulness from having the treatments. So that within the month where I'd have the week of the pain in my joints from the chemo, I didn't have that anymore. And I was so grateful that that was over so I could start regaining my life. My hair started to come back, but that wasn't a priority for me. However, just not having the lack, the pain and the lack of ability to do normal life things, it was what I was looking forward to.
One of the things that we're going to be talking about today in our education series is about late-term side effects of cancer treatment. You mentioned several short-term side effects. Did you have any long-term side effects?
Yes, I did. I developed neuropathy, peripheral neuropathy. I have lost feeling in my feet. And so I have, if the doctor takes a little, like a pin and he runs it along my feet, I cannot feel that. So therefore it's affecting my balance to an effect. So I do use a cane to try to maintain my balance. I have lost some of the feeling in my fingers. So I noticed that just picking up things. And then my motor skills my fine motor skills have also deteriorated. So mostly, I guess, it's my gross motor and fine motor skills. And one other area that I do notice some change is in my word retrieval ability, that I still have difficulty finding names, and I don't have memory issues, but mostly finding names and dealing with numbers. So I have some more difficulty than before. So anyway.
Do you think it's improved in the years since you received the chemo, or do you think it's about the same?
I think my retrieval is a little better because I do some exercises, I do games that help me with my retrieval. My motor skills have deteriorated, especially my gross motor, my neuropathy on my feet. And I've tried different medications that podiatrists have prescribed, and nothing really has helped it neurologically.
So in recent years, patients who receive cancer treatment that is deemed curative receive what they call a cancer survivorship care plan when they're done with treatment. Did you receive anything like that at that time?
No, I did not, and I would have appreciated something like that.
What it entails is a treatment summary. I call it a one-stop shop because it says all your doctors and their phone numbers, and then it tells you when you were diagnosed, when your biopsy was, when you received chemotherapy, when you had surgery, the different types of chemo. It tells you the possible long-term side effects, and how to follow up, what kind of cancer surveillance is needed, and what kind of tests are recommended. And also there's a portion at the very end that the patient could say any concerns they have or lifestyle changes that they would like to make. So
that would be a wonderful tool, because I feel now that it's been several years out, that sometimes when people ask me questions, I have to stop and think, even though while you're going through it, you think I'll never forget this, that all that I'm going through and what it's called and this and that. It's like, yes, over time, thank goodness we slowly forget. And I really think that would be a wonderful tool to have, and so it also to remind you to do your follow-ups and, what's necessary to maintain your health.
Perfect segue into my next question. How are you about doing your follow-ups and your testing that's recommended?
Well, I religiously do my follow-ups. As a matter of fact, if it were up to me, I'd have a CT scan of my abdomen every 6 months just to be sure everything's gone. But I do see my whatever it's called, the oncologist that I see through Advent Health, and I see him every 6 months, and think I'm up to a year now. And yes, there is a lot of anxiety before you go in, because you think something is back, and when you hear nothing's back, you're so happy. And I do all the other major screenings that I'm supposed to have, the colonoscopies and the the breast mammograms and whatever the doctor recommends, because my particular case, my cancer could be anywhere in my body. It wasn't typically a gynecologic cancer, although that's where it presented.
So you bring up a very good point, that the screenings that everyone should do are even more important when we're dealing with cancer survivors.
Yes.
And emotionally, or even more than emotionally, but how do you think that it's affected you personally, your cancer journey? How do you think it's affected your life or your outlook?
Well, it was interesting, because I was diagnosed 2 days before I retired from my job. And, you wonder what you're going to do in your retirement. Well, after I finished all my treatments, I realized that I have a whole new perspective on the rest of my life, is that I want to seize the moment to do what I want to do. I'm not going to put anything off. And I was glad for things I had done in my life that I hadn't put off till I retired, because I wouldn't be able to. So I feel like it makes me appreciate every moment, and, appreciate family and friends, and, doing things that I have wanted to do that I know if I put it off, it may very well not be there. So that's mostly what it's done for me.
So seize the day.
Seize the day. That's it. Exactly.
Thank you so much, Ellen. I really enjoyed speaking to you, and thank you for sharing your journey with us, and for your good advice in following up with all the cancer surveillance and testing that your doctor recommends. Take care, and thank you very much.
Thank you. Bye.
So what kind of resources are there out there for patients during survivorship? There are a lot of resources, but as I always tell people, be careful what you look up. Just because it's on the internet doesn't mean it's good. But one of my favorites is the CDC, the Centers for Disease Control and Prevention. When we think of the CDC, we usually think about information about COVID or immunizations, epidemics. Well, they have a wonderful section with videos, podcasts, and printed materials for survivors. And I recommend that everyone go on there. The videos are really good. Live Strong. They have a brochure about survivorship. It has 13 versions. different languages, different ones that are culturally appropriate and for different lifestyles. And they also have a Live Strong fertility program. It has information, resources, and even financial support for survivors who need some assistance with fertility. Some other resources, one of my favorites that I go to probably every day is the American Cancer Society. That's www.cancer.org. They have the National Cancer Survivorship Resource Center. It's wonderful, and they have the national. They have the Life After Treatment Guide, and it's a wonderful resource. One of the ones that most people don't know about is Cancer and Careers, and it helps people with job hunting after cancer treatment. And it also helps people how to discuss your cancer history with prospective employers. It's a very good website. Cancer.net, and they have the ASCO Answer Guide to Cancer Survivorship, which covers just about any question you can think of. And the videos are very good too. And last but not least is NCI, the National Cancer Institute. And they have a booklet called Facing Forward Life After Cancer Treatment. And it's a very concise summary of the things you need to know about looking forward. And I recommend it to all my patients. So I recommend support groups for cancer survivors. I have had patients over the years say to me, I got all this support from family members, from friends during my cancer treatment. The minute I rang the bell or the minute I finished treatment, I was on my own. I didn't know who I was, and no one knew what I had gone through or the fears I had for the future. So I always suggest support groups. I tell patients that I can talk the talk, but I've never walked the walk. So you need to be around people or to speak with people who have gone through similar situations, and they have some good advice, and they can empathize with you because they have been there. And there are just a couple of the support groups, and there are many support groups out there for all different types of cancers, for different age people. There's for Young Survivors Coalition for young women with breast cancer. There's us2.org for men with prostate cancer. There are all different organizations. So please go out there, get support, and realize that if you're in a support group, you could help other people with your experience. And thank you very much for listening and coming today. I can be reached at, my phone number is 386-740-4025. I'm Holly Susie. I'm an oncology nurse navigator at Advent Health DeLand Cancer Center. Thank you.
Well, we thank Holly Susie for her wonderful insight and expertise on living well after cancer. We want to open this time for any questions. Attendees can unmute themselves or type their questions in the chat. I also want to say thank you to Ellen for sharing her experience. I think that she was able to share that her experience is unique and that she did have long-term side effects, but and that the way that she deals with them. Holly also mentioned support groups, which is an important way for survivors to meet up with other survivors to share their experiences and learn from each other. If there's no questions, Our next event for the Cancer Education Series will take place on Thursday, March 10th at 3 p.m. The topic will be nutrition and cancer, sifting through facts versus fiction, and will be presented by Jennifer Robinson, a registered dietitian with the Advent Health North Region. Again, we thank you all for attending. We still have some times for question if there's anybody that has something that came to them later in the meeting, but other than that, I hope everybody has a wonderful rest of their day.